What is a liver biopsy used for in cancer? Imagine trying to solve a mystery about what's happening inside the body. A liver biopsy is like taking a tiny piece of that mystery and examining it closely under a microscope. It's a key tool doctors use when they suspect liver cancer. Sometimes, imaging tests like ultrasound or MRI can suggest cancer, but they can't give a definitive answer. That's where a biopsy comes in. It helps confirm if cancer cells are present in the liver tissue. During the procedure, a doctor uses imaging guidance to insert a thin needle into the liver to collect a small sample of tissue. This sample is usually about the size of a grain of rice. The process can be done with a fine needle or a slightly thicker core needle, depending on what's needed. The whole procedure typically takes about 30 minutes and is often done under local anesthesia. Sometimes, a surgeon might perform a biopsy during a laparoscopy, which involves a small surgical incision. Once the tissue is collected, it's examined under a microscope to look for cancer cells. This helps confirm the diagnosis of liver cancer, which can be of different types like hepatocellular carcinoma or cholangiocarcinoma. Knowing the exact type of cancer is important because it influences treatment options. The biopsy can also reveal how aggressive the tumor is and whether it has spread or invaded nearby tissues. In addition to confirming the presence of cancer, a liver biopsy can provide genetic and molecular information about the tumor. This includes testing for specific mutations that might make the cancer more responsive to targeted therapies. For example, certain genetic changes can guide doctors in choosing the most effective treatment plan for each patient. However, a biopsy isn't always necessary. If imaging and clinical findings strongly suggest liver cancer, and surgery or transplant is planned, doctors might decide to skip the biopsy to avoid risks like bleeding, infection, or rare cases of tumor spread along the needle track. The decision depends on each individual's situation and overall health. It's important to remember that a liver biopsy carries some risks, but these are generally low. Bleeding and infection are possible, and in very rare cases, cancer cells might spread along the needle path. That's why doctors carefully weigh the benefits and risks before recommending a biopsy. Overall, a liver biopsy is a valuable tool in diagnosing liver cancer. It provides detailed information that helps doctors confirm the diagnosis, understand the tumor's characteristics, and personalize treatment plans. Always consult with healthcare professionals to determine the best approach for each individual case, as medical decisions are tailored to each person's unique health situation.